Is this visible? Is this visible? Okay, to start alcohol metabolism, what are the alcohols we can think about? I am not asking about the commercial alcohols. I am asking about the biochemical forms available in our body. Okay. এটাকে বন্ধ করে দাও. So, what are the alcohols present in our body? What are the forms? Number 1, ethanol. What? Then methanol. These alcohols are naturally occurring. Right? These alcohols are naturally occurring, and among these two, which one is present in commercial alcohol? Ethanol. So whenever we will be discussing alcohol metabolism, we will be talking about ethanol metabolism mainly. Methanol is another naturally occurring alcohol, and so is another is isopropyl alcohol. Okay, what is the use of isopropyl alcohol? Sanitizer, alcoholic swabs. Okay, so among these three alcohols, this is the least toxic. This is somewhat toxic. This is most toxic. Okay, clear? Now, upon ingestion of alcohol, where it is absorbed, absorption occurs in stomach and in small intestine. Okay, so 20% of ingested alcohol is absorbed from stomach, and the remaining 80% is absorbed from small intestine. And the absorbed alcohol is transported to liver by portal circulation. Okay, clear? So the least toxic alcohol is ethanol, that is why it is present in commercial alcohols, and the most toxic one is isopropyl alcohol. We don't use it in case of drinking. Okay, now methanol is a adulteration product. Okay, methanol poisoning happens frequently because of the similar odor of methanol to ethanol. Okay, so methanol and ethanol, they smell similar, and methanol is cheaper substance. It is easily available. So sometimes for adulteration purpose, methanol is added to ethanol. Okay, cheap alcohol, and that leads to methanol poisoning. So we will learn about methanol poisoning later on. So now coming to the metabolism of ethanol. It occurs in the organ is liver. Okay, so 90% of alcohol metabolism occurs in liver. What happens to the remaining 10%? It is excreted. It is excreted by urine and breath. Okay, in intact form. As we ingest the alcohol, the ethanol that is evaporated in breath in the same quantity, same percentage, and somewhat is excreted by urine because it is water soluble. So this helps us to detect the concentration of alcohol in blood by breath analyzers. Okay. So as our body excretes alcohol from breath in evaporated form, so the concentration remains same. The exact concentration present in blood will be evaporated and will be excreted in our breath. So the percentage present in breath, alcohol percentage present in breath is similar to the percentage present in blood. That's why it helps in the determination of alcohol concentration in breath by breath analyzer. Now coming to the metabolic pathways. There is one major metabolic pathway of alcohol and two minor pathways. What is the organ I said where the metabolism takes place? Liver. So the step is alcohol, that is ethanol here, is converted into aldehyde. So what kind of reaction is this? Alcohol to aldehyde? Oxidation. Eto? Oxidation, and this is catalyzed by the enzyme alcohol dehydrogenase. Alcohol dehydrogenase. This happens in cytosol with the help of NAD plus and production of NADH. Okay, which aldehyde is formed? Acetaldehyde. From ethanol, acetaldehyde is formed. Next step. So first step, that is conversion of alcohol to aldehyde by the help of enzyme alcohol dehydrogenase. This is alcohol dehydrogenase. And the cofactor here is NAD+. It is converted into acetaldehyde. Ethanol is converted into acetaldehyde. Next step is conversion of aldehyde to acid. So what kind of reaction is this? Another oxidation. Taito? Another oxidation. This is facilitated by aldehyde dehydrogenase. The enzyme is aldehyde dehydrogenase. Here the cofactor is again NAD+ with production of NADH. This occurs in where? Mitochondria. So the second step occurs in mitochondria and first step occurs in cytosol of hepatic cells. Okay, clear? Boja geche? This is the major pathway. Mostly whenever we take alcohol in the form of ethanol, it is converted into acetaldehyde by the help of alcohol dehydrogenase enzyme and NAD+ in the cytosol of liver cell, and in the mitochondria the acetaldehyde is again converted into which acid? Kire? Acetic acid or acetate by the enzyme aldehyde dehydrogenase. Hoyeche? Aldehyde dehydrogenase. Here the cofactor is again NAD+ and production of NADH is here. U4, come to the front bench. Last bench. 4 জন চলে আয় এখানে. So these two steps are clear. So this is the major pathway of alcohol metabolism. What happens to this acetate? This is converted into acetyl-CoA. This is converted into acetyl-CoA and can be incorporated in various metabolic pathways. So from this we can say alcohol gives somewhat energy, right? And what is the amount? It is around 7 kilocalorie per gram. Okay, 7 kilocalorie per gram, but this calorific value is empty calorie. Okay, because with alcohol no vitamin and mineral is there, so no proper utilization of this calorie can be done. So this is known as empty calorie. Okay, empty calorie 7 kilocalorie per gram. Clear? এই পর্যন্ত বোঝা গেছে? Clear to everyone? Now coming to the minor pathways. Minor pathways, there are two minor pathways. Number one is microsomal ethanol oxidizing system. Microsomal ethanol oxidizing system, MEOS. This occurs in endoplasmic reticulum. This occurs in endoplasmic reticulum. And when this occurs not in normal case scenario, not in normal alcohol ingestion, whenever there is excess alcohol intake, or in case of chronic alcoholism, okay, this pathway is run, and this is catalyzed by enzyme cytochrome P450 2E1. Okay, so this is the enzyme which helps in this pathway. Clear? Cytochrome P450 2E1 is the enzyme which helps in MEOS pathway, which occurs in endoplasmic reticulum when there is excess alcohol intake or when there is chronic alcoholism. Okay, what happens in this pathway? Ethanol in presence of NADPH and oxygen is converted into acetaldehyde plus 2H2O plus NADP plus, and here the enzyme cytochrome P450 2E1 acts, and this reaction produces reactive oxygen species. Reactive oxygen species. Unlike the major pathway or the principal pathway, NADH is not getting produced here. NADPH is used to form NADP+, but here reactive oxygen species, which is toxic to our body. Why toxic? It can damage cell wall, cell membrane, proteins, various proteins, and DNA. Okay, so this ROS, which is reactive oxygen species produced by this pathway, okay, and they can damage cell membrane, proteins and DNA, thus leading to cellular damage. Cellular damage. So this is a minor pathway. Another minor pathway is there, but that is controversial. In paroxysms by catalase enzyme, somewhat alcohol is metabolized. So the second minor pathway is controversial, but you should know that in paroxysms, in presence of catalase enzyme, somewhat alcohol is metabolized, and the metabolic product will be acetaldehyde. see one thing, in case of minor pathway also acetaldehyde is produced. ঠিক আছে? So now here acetaldehyde which is getting produced can enter liver cells, mitochondria, and then can be incorporated into this cycle, this pathway, or it can itself again oxidized by cytochrome P450 to acetic acid. ঠিক আছে? So this acetaldehyde which is getting produced in the minor pathway can go to the major pathway and join the second step in liver mitochondria, or else in ER also it can get converted into acetic acid. হয়েছে? এই পর্যন্ত বোঝা গেছে? Clear? Okay. Now another thing, that is this reaction, the major pathway reaction, this follows zero order kinetic. What is zero order kinetic? The elimination rate of alcohol is constant irrespective of its concentration in blood. Okay, so it's not like that if you add more alcohol the reaction will run faster. It will not. The elimination rate is fixed. That's why the more you intake, it will take the longer time to eliminate. Right? So if this is the concentration, this is time plot, so it will take more time if we take more alcohol. Clear? As it follows zero order kinetic. এখান থেকে MCQ আসে, okay, যে alcohol metabolism follows what kind of kinetic? Okay, then come to stages of alcohol toxicity. Clear? Metabolic pathway is clear? Major pathway and minor pathway, everyone? So stages of acute alcohol toxicity. First, it is social stage, where the person taking alcohol is in social dictum, okay, but he will feel euphoric, excited, somewhat excited and somewhat euphoric. Okay, so what is the amount that leads to social stage? It is 0 to 50. This is the amount of alcohol if someone takes, he will show what? Excitability and euphoric state. Okay. Now coming to the next step, that is mild intoxication. Mild intoxication, and why this happens? Euphoria. This occurs because of increased dopamine secretion. Okay, increased dopamine. Next is mild intoxication. Mild intoxication stage is 50 to 550. What happens in this stage? Mild intoxication, neuromuscular incoordination. Neuromuscular incoordination. What does this mean? Neuromuscular incoordination mane ki? Motor movements will be hampered. So motor movements mane walking, talking, driving, all these. This is very, like this is starting of dangerous stages. Okay, now comes the intoxicated stage. intoxicated stage where it is 150 to 300 gram per dl. If someone intakes 150 to 300 gram per dl alcohol at a go, then there will be slurring of speech, confusion, okay, slurring of speech and overall cognitive confusion. What is cognitive? Cognitive confusion means he will not be able to tell his own name or his address. Cognition is hampered. Okay, clear? Next step is stupor or comatose step. Stupor or coma. If it is more than 300 to 400 or more than 300, what happens? Breathing difficulty and unconsciousness. If untreated, this may lead to death. If untreated in this stage can lead to death of the patient. Okay. And one more thing, in these previous three steps, pupil is dilated, but in this state it is constricted. ঠিক আছে? So these are the 4 stages of intoxication, alcohol intoxication, acute alcohol intoxication. In case of driving, or what I told that by breath analyzer test, what we detect? We detect this concentration of alcohol in our blood by breath analyzer, and what is the permissible range? It is less than 30 gram per dl. Less than 30 gram per dl. More than, if it is more than 30, there will be drink and drive case. তাই তো? হয়েছে? So this is the below 30 gram per dl is permissible, but more than 30 is punishable. হয়েছে? Clear? Now come to the enzymes. What are the two main enzymes? Alcohol dehydrogenase and aldehyde dehydrogenase. তাই তো? In major pathway, these two are the main enzymes. We have to know the difference between these enzymes. Okay. So in case of ADH, it is cytosolic enzyme. ADH or alcohol dehydrogenase is cytosolic enzyme, whereas aldehyde dehydrogenase is second step of alcohol metabolism was happening in mitochondria. So this is mitochondrial enzyme. In case of alcohol dehydrogenase, coenzyme is zinc. Zinc is the coenzyme, whereas no such coenzyme is known in aldehyde dehydrogenase. Okay, so coenzyme zinc is used in alcohol dehydrogenase. No such coenzyme known in case of aldehyde dehydrogenase. In case of cofactor, what is the cofactor for both these enzymes? NAD plus. Okay, NAD plus, and in both the reactions NADH is produced. তাই তো? And alcohol dehydrogenase leads to the formation of which compound? Aldehyde, mainly acetaldehyde. And whereas aldehyde dehydrogenase leads to elimination of that aldehyde into acetate. or the aldehyde produced, acetaldehyde produced is converted into acetate by aldehyde dehydrogenase. Bujha geche? Clear? Now one thing, the activity of alcohol dehydrogenase is higher than aldehyde dehydrogenase. Activity of alcohol dehydrogenase is higher than aldehyde dehydrogenase. That will lead to accumulation of which product? Acetaldehyde, because the intermediate product is acetaldehyde. So first step is faster, or the activity of ADH is more than ALDH. So the second step is slower. That means elimination of acetaldehyde is slower in our body. That is why accumulation of acetaldehyde gives the hangover effect. ঠিক আছে? So even after taking alcohol, like after 12 to 14 hours also, we can feel the symptoms of hangover. So that is because of accumulation of acetaldehyde. And why the acetaldehyde is getting accumulated? Because the second step is slower than the first step, or the enzyme ALDH is slower in activity than ADH. Clear or not? No response. Like you all have not taken alcohol, right? So louder. Now hangover symptoms bolte amra ki bujhi? What are the hangover symptoms? এটা তো সবাইকার বলা উচিত, মুভিতে সবাই দেখায়, কারোর কারোর পার্সোনাল এক্সপেরিয়েন্সও হয়তো আছে। আছে কারোর পার্সোনাল এক্সপেরিয়েন্স তোদের হ্যাংওভারের? So what are the main hangover symptoms? একটা কালেকটিভ অ্যানসার কিছু পাওয়া যাবে কি? কিছুই পাওয়া যাবে না? জোরে জোরে বল। আমি জানি তোর হয়তো হয়নি, কিন্তু তুই এমনি বলছিস, বল। আনকনশিয়াসনেস একদম লাস্ট স্টেজ। ও তার মানে ওর কোনো হ্যাংওভার কখনো হয়নি, ঠিক আছে? সেই জন্য ও বলেছে ও আনকনশিয়াস হয়ে গেছে। Anyone else? Dizziness. Hangover is not the excitement stage. Hangover is not the social stage. Hangover is not the social stage or the immediate effect. Hangover is the lingering effect of alcohol intoxication, তাই তো? So which we may perceive after 12 to 14 hours, even after 12 to 14 hours. তাহলে that includes headache, nausea, vomiting, flushing of skin, sweating, all these, diarrhea. Okay, so if asked what are the hangover symptoms, you would not be asked like what are the hangover symptoms, but there is a question. Why there is a question? Because the enzyme ALDH, they have genetic variant. Okay, in Asians ALDH activity is further low. Like in normally ALDH is less active than ADH. That leads to that hangover effect in general all over the populations. But in case of Asians and South Asians, okay, so the ALDH is further mutated, thus it is further less active. That leads to more intoxicating effects in Indians, mainly Indians. We are talking about Indians, okay. So in case of Indians, the effect hangover effect, or in case of Asians, hangover effect is more because of the mutated variant or genetic variant of ALDH, that is aldehyde dehydrogenase, okay. And all the symptoms are, as I told, like flushing, sweating, palpitation, tachycardia, headache, nausea, vomiting, diarrhea, and all these. ঠিক আছে? So this symptom, this overall property, this is syndrome, this is known as Asian flush syndrome. Okay, Asian flush syndrome. In this question, you may be asked like what are the symptoms? Okay, what are the symptoms and why? হয়েছে? Clear? এই পর্যন্ত বোঝা গেছে? Okay, next coming to the effects of alcohol in our body. Biochemical alterations occurred by alcohol intoxication. So accumulation of acetaldehyde leads to this flushing syndrome. Why? Because acetaldehyde binds with number 1, effects of acetaldehyde. Effects of acetaldehyde. Number 1, binds with glutathione. Binds with glutathione. What is glutathione? Huh? Major antioxidant of our body, right? So it binds glutathione, decreasing the antioxidant property. Next, it forms adducts with proteins and amino acids. Okay. Glutathione binds with proteins and amino acids to form adducts, and these lead to cell damage. Cell damage, which may further be replaced by fibrosis. Fibrosis. Acetaldehyde binds with proteins and amino acids and forms adducts compounds which may further lead to cell damage and fibrosis. From fibrosis, which organ fibrosis is most common? Fibrosis of which organ? কোথায় metabolism টা হচ্ছে? Acetaldehyde is getting stored in which organ? Liver. So liver fibrosis. Liver fibrosis leads to cirrhosis. হয়েছে? লিভার সিরোসিস কেন হবে বোঝা গেছে? হ্যাঁ, ক্লিয়ার? আর এছাড়া আর কি করে? accumulation in mitochondria leads to damage in mitochondria. Overall damage of mitochondria leading to decreased energy production. And last, it inhibits microtubule formation. So acetaldehyde by these mechanisms is toxic to our body. হয়েছে? Clear? So these are the 4 mechanisms by which acetaldehyde plays a toxic role in our body. Now comes the next biochemical alterations. হয়েছে? Clear? এগুলো হয়ে গেছে? In the major pathway of alcohol metabolism, what is produced other than the acid and aldehyde? What is produced? In the major pathway of alcohol metabolism, in 2 steps, in each step, what is produced? NADH. So, in chronic alcoholism, increased production of NADH is there. Okay. So, when there is increased production of NADH, that will lead to conversion of pyruvate to, in presence of NADH, pyruvate is converted into, জোরে বল, কেউ বলতে পারবি না? lactic acid. তাই তো নাকি? And oxaloacetate. oxaloacetate কোথায় আছে রে? oxaloacetate কোথায় আছে? Krebs cycle এ. So oxaloacetate is converted into malate. In Krebs cycle, malate is converted into oxaloacetate and their NADH was produced. But here much more amount of NADH is present in body that leads to production of malate from oxaloacetate. Now see, this will lead to lactic acidosis. This will lead to lactic acidosis. Clear? Lactic acidosis. And these two are main substrate. Pyruvate to oxalate kothay hoy? Where this pyruvate to oxalate conversion occurs. This is the first step of gluconeogenesis. Gluconeogenesis, when there is production of glucose, need to production of glucose from non-carbohydrate moieties like protein and fat. Pyruvate is converted into oxaloacetate. So this pathway will be hampered. In case of NADH, increased concentration because of alcohol metabolism. So no gluconeogenesis. No gluconeogenesis will lead to hypoglycemia. Hypoglycemia. Why there will be hypoglycemia? Because gluconeogenesis is hampered. So what kind of hypoglycemia? When gluconeogenesis occurs in our body normally, in which condition? In fed state or in fasting state? Fasting state. So in fasting hypoglycemia will be seen in chronic alcoholics. So number one that can be seen is lactic acidosis. Second is fasting hypoglycemia. Fasting hypoglycemia. Clear? Concept clear? Why this is not present? Because this will be converted into this. Oxalate will be converted into malate. So concentration of pyruvate and oxaloacetate will be decreased. And this interchange will not be possible. ঠিক আছে? বোঝা গেছে এই দুটো? Next comes this lactic acidosis will lead to hyperuricemia. এটা তোরা জানিস? জানিস তো? কেন? Because in normal body pH, uric acid is in soluble states. তাই তো? But in lactic acidosis, what happens? Decreased pH is there, leading to precipitation of urate crystals in joints. And this is acute gout, acute attack of gout. That's why in alcoholic patients there are more acute gouty precipitations or acute attacks of gout is more. তাহলে এটা হলো কত নাম্বার? 3 নাম্বার. These are the biochemical alterations and their effects on our body. So first of all, lactic acidosis is happening because pyruvate is getting converted into lactic acid because of increased NADH, and then there will be no gluconeogenesis leading to fasting hypoglycemia. Next, in lactic acidosis, hyperuricemia. This hyperuricemia is because of another cause. What is this? Another cause, ki the ROS that was damaging the DNA or RNA will lead to more production of uric acid. Yes or not? ROS কোথায় তৈরি হয়েছিল? What is ROS? Reactive oxygen species. কোথায় তৈরি হয়েছিল? Microsomal ethanol oxidizing system in endoplasmic reticulum. Clear? হয়েছে? তো অ্যালকোহল, যে ক্রনিক অ্যালকোহল খেয়েছিল তারই তো এমইওএস অ্যাক্টিভেট হয়েছিল, যে একদিন বিঞ্জ ড্রিঙ্ক করেছে তার ক্ষেত্রে হয়নি। বাট ইন কেস অফ ক্রনিক অ্যালকোহলিক্স the minor pathways are activated and thus the ROS is produced. হয়েছে? এটা পর্যন্ত ক্লিয়ার? নেক্সট কি হবে? When there is lactic acidosis and when there is this pathway is not going this way, there will be accumulation of acetyl-CoA also. Acetyl-CoA accumulation will also be there. Whatever pyruvate is getting produced cannot go this way, so this will produce acetyl-CoA, which will be increasing the amount of ketone bodies, leading to ketosis. So number 4 condition will be ketosis. Pyruvate accumulation or whatever pyruvate is getting produced will be converted into acetyl-CoA, or acetyl-CoA will be accumulated as there is no oxaloacetate, so no TCA cycle, even no TCA cycle. No TCA cycle. Okay. So acetyl-CoA will be accumulated and it will lead to ketosis. Again, this acetyl-CoA can be used for, আর কিসে ইউজ হতে পারে acetyl-CoA? acetyl-CoA কিসে, কোন ম্যাক্রোমলিকুলার বিল্ডিং ব্লক? ফ্যাটি অ্যাসিড সিনথেসিস হবে কিনা রে? হ্যাঁ? Okay, so there will be increased fatty acid synthesis that will lead to increased triglyceride in blood. হয়েছে? And along with fatty acid synthesis decreased, beta oxidation is increased fatty acid synthesis, beta oxidation of fatty acid is decreased. Beta oxidation of fatty acid is decreased. So what happens? The concentration of fat in our body increases. তাই তো? Increase TG. Increase TG মানে কি? Hyperlipidemia. And this will lead to fatty liver. So this is 5, fatty liver. হয়েছে? সিরোসিস কেন হবে বলেছিলাম? ফাইব্রোসিস থেকে। What is cirrhosis? Irreversible fibrosis and scarring and shrinkage of hepatic tissue is cirrhosis. Fatty liver is the initial stage. Fatty liver is reversible, but cirrhosis is not reversible. হয়েছে এই পর্যন্ত? তাহলে 1 2 3 4 5. Okay, now coming to disruption in vitamin absorption because of alcohol. In chronic alcoholics, there is deranged absorption of vitamin B1, B3, B6, B9, A and D. কি হয়েছে? এত কথা কেন? এত কথা কিসের? So there is decreased absorption of B1, B3, B6, B9, A and D. Among these, all the 6 vitamins, B1, B3, B6, B9, A and D, B1 is mostly hampered. B1 is thiamine. Thiamine absorption is hampered most. ঠিক আছে? Because of alcohol. Presence of alcohol in gut decreases the absorption of these vitamins, among which thiamine absorption is mostly hampered. So thiamine deficiency will lead to peripheral neuropathy. Okay, Thiamine deficiency or vitamin B1 deficiency will lead to peripheral neuropathy, which is known as Wernicke's syndrome. Wernicke's syndrome. Peripheral neuropathy known as Wernicke's syndrome. And here neuropathy is peripheral. Peripheral neuropathy. What is peripheral neuropathy? Ataxia is there. Ataxia means unstable gait. Okay, inability to walk straight. That is ataxia. There would be nystagmus. And there will be psychosis. Psychosis. In psychosis, what happens? Memory loss and confabulation. Confabulation. What is confabulation? What is confabulation? Telling lies. Okay. So, in chronic alcoholics, there will be thiamine deficiency that will lead to neuropathy known as Wernicke's syndrome, where we can see peripheral neuropathy where he cannot walk straight. Okay. And his eyes cannot focus one thing, that is nystagmus. Pupils will be fluctuating. Okay. And in case of psychosis part, what will happen? Patient will forget whatever he is doing and he will tell lie. Okay. So, these are the symptoms of Wernicke's syndrome. This may also come as a short note. Wernicke's syndrome. Okay. Now for de-addiction. बहुत हो गया, बहुत पी लिया, है ना? Now we have to go for de-addiction. And what happens in de-addiction therapy? De-addiction e ki hoy? Huh? Withdrawal hoy. Why withdrawal? Withdrawal to hoy. Otherwise আমরা কিসে ট্রিটমেন্ট করি? ট্রিটমেন্ট হচ্ছে acetaldehyde to acid. Enzyme was, what was the enzyme? From acetaldehyde to acid, ALDH. Here is a drug which inhibits this. Disulfiram. So, patient is treated with this drug. What happens? When patient takes disulfiram drug, ALDH is inhibited. So, this pathway is inhibited. Taito, this pathway, inhibition of this pathway will lead to accumulation of this product, and this will lead to increased unpleasant symptoms. Okay. If this pathway is intact, patient will metabolism will run as it is. But when this pathway is inhibited, this step is inhibited, what happens? Acetaldehyde is accumulated and he will perceive more and more unpleasant symptoms. Okay. So that's why he will fear of drinking more. Under supervision kora hoy. Okay. Jate he takes the medicine regularly. Clear? So this is for de-addiction. Now one thing, that is fetal alcohol syndrome. This is also asked. Fetal alcohol syndrome. When this happens? When a pregnant mother takes alcohol during pregnancy. So this lead to transfer of acetaldehyde and alcoholic metabolites to cross the placenta and to brain of the fetus. Okay. And this leads to low IQ baby. Not only low IQ baby, but in fetus, ADH is much required. Alcohol dehydrogenase hormone is much required in fetus. Why? Because ভিটামিন পড়া হয়ে গেছে তো? ভিটামিন এর অ্যালকোহলিক ফর্ম কি? হোয়াট ইজ দ্য অ্যালকোহলিক ফর্ম অফ ভিটামিন এ? alcohol form ki? Retinol. So this retinol is converted into retinal or retinaldehyde by ADH enzyme. Okay. Alcohol dehydrogenase is required in fetal body to convert retinol to retinal, and retinol is converted by ALDH into retinoic acid. Retinoic acid, which is very important in cell differentiation and cell growth. So if this is inhibited, why this is inhibited? When a pregnant mother takes alcohol, this ADH gets inhibited in fetus. Okay, so this is hampered, and cell differentiation, cell growth, all these hampered. ঠিক আছে? This will lead to কি হবে? ফিটাসটা কেমন হবে? লো বার্থ ওয়েট, সেল গ্রোথ হবে না, ফিটাস will have low birth weight and low IQ, short stature, microcephaly, etc. So fetal alcohol syndrome, where fetus er kono bhumika nei, where there is no role of fetus in his own syndrome, it is because of his or her mother's choice, tai to? So that's why alcohol is absolutely contraindicated in pregnancy. hoyeche? Acha, now come to the biochemical markers. আর 5 মিনিট লাগবে, ঠিক আছে? 15 মিনিট পর আমি ক্লাস পেয়েছি, তাই আর 5 মিনিট লাগবে। So biochemical markers in alcoholism. Those who don't want to stay, you can go. Don't disturb. So biochemical markers for assessment of alcoholic disease or alcoholism. So alcohol mainly affects which organ? Liver. So mainly we can see alcoholic hepatitis. Okay, so in case of alcoholic hepatitis, we will perform liver function test. For any kind of liver assessment, what we do? We do liver function test. What are the parameters in liver function test? Jhotpot bol, bilirubin, total protein, albumin, আর enzymes কি আছে? AST, ALT, alkaphos, তাই তো? So here in case of alcoholic liver disease, what happens? AST is to ALT ratio is reversed. In alcoholic liver disease, in normal case scenario, AST is to ALT is approximately 1, same value. Okay, in case of viral hepatitis, ALT by AST is more than 1. ALT by AST is more than 1 in viral hepatitis. But in case of alcoholic hepatitis, AST by ALT is more than 2. Normally, AST is to ALT is more or less 1:1. In case of viral or infectious hepatitis, it is ALT by AST will be more than 1. But in case of alcoholic hepatitis, AST by ALT will be more than 2. ঠিক আছে? From liver function test we can check this part. তাছাড়া increased bilirubin can be there, okay, because of hepatitis. Increased GGT, what is GGT? Gamma glutamyl transpeptidase. Gamma glutamyl transpeptidase, this is a marker for fatty liver. This is a marker for fatty liver. This is non-specific for alcoholic hepatitis, but this is a marker, this is specific for fatty liver. Okay? হয়েছে? আচ্ছা, এবার লাস্ট একটাই জিনিস বাকি আছে যেটা হচ্ছে মিথানল পয়জনিং। আগেই বলেছি মিথানল is used for adulteration of normal commercial alcohols for its cheap availability. So methanol poisoning leads to blindness. Methanol poisoning leads to blindness because the intermediates of methanol metabolism, that is formaldehyde and formic acid. Methanol থেকে কি তৈরি হয়? Methanol to formaldehyde and formic acid. So this is by ADH, this is by ALDH. Okay, so these two are toxic, very toxic, and they affect optic nerve leading to blindness. Okay, so what is the treatment? What is the treatment in case of methanol poisoning? There is a drug that blocks ADH. It is fomepizole. Fomepizole blocks ADH. Thus, the further steps of methanol metabolism is blocked. ঠিক আছে? And formation of formaldehyde and formic acid can be prevented. And along with fomepizole, we can add ethanol. Okay, proper ethanol can be added for competitive inhibition purpose. Competitive inhibition. Whatever ADH is present will bind to ethanol and will be converted into acetaldehyde. Okay, next, so first methanol poisoning er first treatment হচ্ছে fomepizole, which is ADH inhibitor. Next, ethanol. Third is dialysis. Dialysis to remove the toxic methanol from our circulation. হয়েছে? Clear? Alcohol metabolism শেষ. Huh? And this part may seem very short and very easy, but এখান থেকে question আসে। ঠিক আছে? Why there is precipitation in gout in alcoholics? What is Wernicke syndrome? What is the tolerable permittable level? What is the fetal alcoholic syndrome? All these come in your exam as short note. Okay, thank you.